Good morning, everyone, and welcome to the webinar. Today is part 2 of Anthem, and once again, we're joined by our friend and colleague, Kathy Shiplett of Anthem. And people are just getting online right now. We were talking about crazy weather in Cincinnati over the weekend, 20 degrees Sunday morning. Today it'll be bright and sunny, 75 degrees. The only downside to that, it's going to be really windy. So spring has sprung here in Ohio, and I'm really excited about that. And let's get started. So Anthem's Ancillary products and online tools is what she'll be discussing today. Just some housekeeping. If you have a question, put it in the chat box, well, really the question box to the right, and we'll get to those at the end of the presentation. Like last week, today is just a short 30-minute presentation, and we'll answer those questions at the end of the presentation. Here's our information, both Eric and myself, and Eric needs to take a bow. He is walking down the aisle this weekend, so we're really happy for Eric. And he's getting married on Saturday. And more information, never miss a webinar. All webinars in this series and others are available 24/7 in the Resource Center, which is located on the Cornerstone website. Check it out, the Resource Center, really easy to access. There's a ton of stuff out there. I use it all the time, pulling up details on past webinars across the full spectrum, individual, group, everything. As always, check out Health Sherpa. It's free. It's a free service. This is something that Eric and myself can talk to you about. This is your enrollment platform. Health Sherpa, it's the way to go to enroll your clients. And okay, so Kathy's on the line. Let's toss it to Kathy. And Kathy, can you take yourself? Are you still on mute?
Yep. No, I'm off mute now. Good morning.
Fantastic, fantastic. Let's toss it to Kathy, and away we go.
Wonderful. Good morning, everybody. Thank you for joining us again. If you were with us last week, today I'm going to be going over our dental and vision individual products. And so let's go ahead and jump right in. I have lots of information to cover. I may not get through everything because I have a lot of screenshots of where to find information, quoting, and so forth. So if we don't get through all of these slides, I will be sharing these with Geoff. He can send them out to you so that you do have all the detailed information, and also as a reference guide to what we are covering. So the reason that we thought this would be a great time to talk about, and I've already jumped to dental, but that's okay. The reason we thought that this was a great time to be talking about individual dental and vision products is because these can be sold year-round without, you don't need a qualifying event, you don't need open enrollment. So dental and vision can be added for your clients all year round. So we wanted to take a look at what Anthem has to offer. So with our dental plans, we use the Prime network for our individual policies. So when you're doing, find a provider, you'll be searching for the Prime network. And with our our network is one of the largest in the nation. 135,000 dentists with those are individual dentists at 548,000 different locations. With our dental plans, there is an average network discount of 39%. This comes into play after you've reached your maximum benefit. It also helps to keep the cost down so that you're not when you're paying the 20% or the 50% cost share, you're not getting to your maximum as quickly because you're paying less. We see nationwide 73% network utilization, and of course we have out-of-network benefits as well. If that, so that if all the dentists are not in an area, there's certainly benefits there as well. Some of the benefits of having Anthem's Dental is our whole health connection. Teledentistry is available. This is something that where people can call in and talk to a dentist about issues that they are having. They can even, in some situations, prescribe pain medication if necessary. And it also includes international emergency dental programs for when you are traveling. And according to some integrated studies that we have, when you have dental coverage along with medical, we are seeing 10% less emergency room visits, 13% less inpatient admissions, and 20% less heart attacks. And this is due to a lot of different conditions are able to be first identified in the mouth. So a lot of heart disease, diabetes, things like that. There's cancer, that these conditions can be first detected in the mouth. So dental products are very important to go along with our medical plans. So all of our plans come with online tools to help the members better understand their plans and to have that access readily available to them. We have Ask a Hygienist, where you can email questions to a licensed dental professional and receive advice at no additional cost. We have the Dental Cost Estimator, and this is a tool that helps you estimate the cost for dental procedures. And this is a basic general, it's not dentist specific, but gives you an idea of the services in a specific zip code. We also have a dental health assessment. After answering a few questions, you will get feedback based upon your responses. And as I had mentioned before, the teledentistry. So this offers the virtual dental care, including emergency exams. And then when you are away from home, if you're traveling outside of the US, you still have access to emergency dental services through our International Emergency Dental Program. And this comes with all of our dental plans. You can receive help finding an English-speaking dentist for urgent dental care needs. You can get help with translation services at the dentist's office. And the services that you receive through this program do not count towards your yearly limit. So a great plan to have if you are ready to be out and about and traveling again. So we have two different platforms for our dental plans. Members receive 100% coverage on either platform, 100% coverage for preventive care. This is including regular dental cleanings, exams, x-rays, when they receive care from a dentist that's in the network. All of these plans cover preventive care with no waiting periods. So this will never be something that a member has to wait a certain amount of time before they can have their preventive dental cleanings. Our Essential Choice PPO plans feature higher annual benefit maximums. They're richer plans than our other platform, which is the family PPO plans. And it also has carryover for an unused dental benefit. So your maximum, if you do not use all of your maximum, a portion of that can be carried over from year to year. Over time, this means that you could double your annual maximum benefit. The Essential Choice PPO plans also have shorter waiting periods than our traditional plans for basic and major services. And we have one very rich plan. It's called our incentive plan that does not have any waiting periods on it at all. So we have individual specialty product guides that include the benefit tables is what I'm showing here today. We have a total of 9 dental plans. It's a lot, and there's a lot of moving parts, but it's what you would typically expect. It's going to be the waiting periods, the co-payments. It'll be the benefits will be 180/50, 150/50 out of pocket maximum or out of. I'm sorry, benefit maximums vary, as well as some plans that offer ortho. So there's a lot of different varieties. I suggest picking one or two as your go-tos and start with that. So those would be the ones that you're always quoting at, always talking about. With the Essential Choice PPO plans that are on the screen now, there's bronze, silver, gold, platinum, and an incentive plan. And as I mentioned, these are richer benefits than what are available on our other platform, which is the Family Dental. We'll review that next. With the Essential Choice plans, they do not include pediatric essential health benefits. So this would be something that you would pair with an ACA policy, because the essential health benefits for the pediatric dental is already included on the medical plan. No waiting periods for diagnostic and preventive, and these plans include the maximum carryover. The family dental plans do include the essential health benefits for children age 18 and younger. So these would be the plans that you probably want to focus on when you have members that are not on an ACA plan, because the child benefits would not be included under their medical. The family plans are available both on and off exchange. And there are 4 available plan designs. There's preventive, value, family, and family enhanced. And as I mentioned with the other plan designs, there are no waiting periods for diagnostic or preventive. And I'm not going to go through all of the benefits, and it's very small on your screen, I'm sure. But we do have the product guides that are available, and I'll show you where we can find those later in the presentation. So just as a recap, the family dental PPO plans include the pediatric essential health benefits. They are the most affordable plans, and they are available on and off exchange. The essential choice plans offer the richer benefits, do not have the pediatric essential health benefits, and is only available off exchange. So let's switch gears and talk about our vision plans. We have one of the largest national networks, which includes a mix of independent vision providers and national retail locations. There are over 39,000 doctors at 29,000 different locations in our vision network. And just looking at the number of independent providers, we still have more providers in our network than some of our leading competitors. We also have access to online retailers 24/7, including glasses.com, Contacts Direct, and 1-800 contacts. And as you can see, the logos at the top of the screen, we include a lot of the major vision plan providers, which would be glasses. Well, as I mentioned, the online ones, we also have Lens Crafters, Pearl Vision, and Target Optical. We offer 40% off of unlimited additional complete pairs of glasses, in addition to 20% off of accessories. And this can be lens upgrades and non-prescription sunglasses. Members can also take advantage of discounts on LASIK vision correction and more through our special offers programs. And the members enjoy about a 75% average in network savings. This is huge. If anybody has been to a vision provider lately and shopped for glasses, you know what I'm talking about. It's shockingly expensive to get a new pair of glasses. But when you're part of a vision plan with Anthem, our in-network discounts are about 75%. Our network has an 80-20 mix of independent eye care providers versus retail network stores. And our vision network, we see 97% in-network utilization rates with our Blueview Vision network. So this is huge. Let's see. Sorry, let me switch over to the next slide. Okay, so with our individual vision, we have add-ons at no additional cost, including factory scratch coating on eyeglass lenses, discounts for transitions, progressive lenses, anti-reflective coatings. We have value-added savings of 15 to 40% on most extra sets of glasses, contact lenses, lens treatments, specialized lenses, and accessories. And we also offer the discounts, special offers at Anthem for LASIK and other products that are promoted for better health and well-being. Again, we have 9 different vision plans to select from. We have one plan that is the Blue View Vision Bundled Plan, and the bundled plan is designed so that it can be purchased in combination with any off-exchange individual medical or dental plan. So the bundled plan offers a basic, your basic $20 copay, um, lenses every 24 months, eye exams every 12 months, a maximum benefit, and I'm not finding not finding that. The frame allowance, $130. So a very basic vision outline of benefits, and this would be at a lower cost because it is offered only as a bundle. This same outline of benefits is also available as the value plan. The value plan would be something if you were selling it standalone, you would switch over to the value plan for that. So this is just more of the plan designs that we have. To try to break it down a little bit, we have a bundled, enhanced, plus, value, basic, premier, ultra, and then we have progressive preferred and progressive select. And the ones with progressive in their names means that there's extra benefits there for progressive lenses. So again, I would suggest picking a plan design and one or two and running with those. Have those as your go-to, because it can be overwhelming for somebody who is looking at maybe vision and dental benefits for the first time. 9 plans is excessive. We're offering those so that, if you have a certain situation where we have the benefit design that would best work for that. But as a general rule, I would say pick 1 or 2 and roll with it. And again, here's some more vision plans that are available. This is the Ultra plan design. And again, these are all included in our product guides, so that this is something you can have available with you when you're meeting with clients, or have it online so that you can refer to it. Next, I'm going to go into, because we do have some time here, I'm going to go through some slides just to give you a visual of what it's like to quote the dental and vision. This can be done 2 ways. The first way I'm going to show you is quoting it online as you would an individual medical product. So the first thing you do is you select individual Ohio Affordable Care Act, and then click on the Create Quote button. The next screen you see, you just put in the zip code and the county, and you can select if you want, and I apologize, I've got my little, let's see if I can, nope, I can't change that now. This is blacking out the wrong piece, but that's okay. So you can select medical with dental and vision, dental with optional vision. So even if you want dental only, it would be, you can select this because the vision is optional. And the next button, which I inadvertently covered up, is vision only. So you can have standalone vision. And please disregard the writing agent. I just had to pull something up so that I could do a screenshot there. That will obviously show your writing agency. So the next screen, it brings up your options for the dental. And with the dental, you would select the dental first, and then you see this on the screen where it says vision add-on, and you can go down the drop-down box and select which vision plan that you want to look at. When you are looking at these, you can sort them any way you want. This is sorted by the monthly cost. And the Family Dental Preventive is the first one that comes up, because this is something that is going to, it has the embedded pediatric benefits, but for the adults, it is a $750 maximum benefit. And if you select, and I can't do it on here because these are screenshots, but if you can always select view plan details, and it will give you the benefit summaries. So for this situation, I am selecting the dental family preventive, and I selected a vision add-on, and then I just click on apply now. And that will take us to this next screen. And this is where we start the application process. So after you get the quote, if you are ready to apply, you can do this by going through the screens yourself, putting in the applicant's information, products, any other coverage, signatures, payment form, and then submission. Or you can, at this point, transfer it to the consumer. And if you hit the transfer to consumer, it will bring up a box where you put in their email address and a note from you. So you can put in a detailed little note on there that they will receive with the email. And then the member can pick that up and complete the application themselves. So that is the online version. So dental vision can be sold standalone, or it can be along with the medical. We also have, as I had mentioned, we have the product guides. We also have rate sheets that are available, so that if you are wanting to quote this or have it with you as a reference, you can do that. You don't have to go online and go through the screens in order to get the quotes. And for this, you can go to a website called anthembrokerhub.com. This is something that we have put together across all states. So if you're doing business in Indiana and Kentucky, you do group, you do Medicare, the information is available on anthembrokerhub.com. So we're going to filter this down. And the filters on the left side of the page, we want to look at individual in Ohio, and all of the different plan options or the marketing materials will be coming up on this screen. So as you can see, I didn't filter by specialty, so it's going to show me the medical benefit charts. But as we scroll down, embedded pediatric and vision is in here. The rate sheets and the product guides are both available on the Anthem Broker Hub. In order to get an application, the applications are actually housed in a different location. This is going back to your producer toolbox where you run your quotes. Instead of clicking on home or book of business, you would go to the tools and resources. From there, you click on all resources and forms, and then you have the filters for Ohio, individual, and 2022. And in here, we will want to select applications and forms that are listed under the medical. And that will include the application that you can use strictly for dental and vision, but all of the applications are listed under the medical policy. So I think I actually got through all of my slides. So I guess, Geoff, at this point, we can open it up for
Oh
any
yeah,
additional questions.
great, thanks. Very informative. We do have a couple of questions, and they're right there in the question box to the right. You can add your questions. First question is, are these plans available in the over 65 market?
That is a good question. And let me, we have there is one plan design I came across that is available over 65. And if you give, let's go on to the other question while I look up to make sure I'm not telling you something wrong on here, and I'll look that up and tell you which one it is here shortly. Okay, we have a dental plan that is available for over 65 as well. And the essential choice PPO plans. There, when you look at the rate chart, it will have rates for under 65 and over 65. Those are the only two breakdowns for the essential choice PPO plans. So those are available over age 65.
That's great. Okay. Will short-term plans be discussed today? So short-term, I know we touched on that last week, and we do have a recording of all of that. But
Yes,
could you just, if you could give like a nickel tour of
absolutely.
short-term?
Absolutely. And since it's such a sunny day, I'll give you a 10-cent tour. How about that?
Okay.
Our short-term plans in Ohio are available for 364 days. They start on the 2nd of the month, so that it ends on the last day of the month. They are medically underwritten. Our underwriting is not an all or nothing situation. We do rate for medical conditions. So where you may have experience with other carriers of, if you answer yes to a question, you're out. That is not the case with our medical underwriting. So we also have an underwriting guide that is available on anthembrokerhub.com. That underwriting guide goes through a lot of the, automatic declines, gives you an idea of, what the rate ups would be for some conditions, the height weight charts. That information is available. A lot of information in that guide. We do not have renewability, so they do have to reapply each year. And we have two different sets of plan designs. One is a little bit leaner, where you don't have preventive covered at 100%. There's only drug copays for the first two tiers. But then we also have our plan designs that are more robust. And all of our plan designs cover pre-existing conditions from day one. We do have a couple of plans that cover preventive at 100%, have all the drug copays. So really, depending on what your customer is looking for, if they want, looks and feels like a fully insured plan with all of the bells and whistles, we have that. And if they're looking for something, more value-based, we have those plan designs available as well.
Okay. And what is the name of that short-term plan?
It's called Anthem Enhanced Choice. We refer to it as AEC.
AEC.
Mhm.
Fantastic. Okay. And next question. When we search for providers online, and this I think has to do with the dental, when
Okay.
we search for providers online, do we search the plain blue view vision or the insight or the select blue view vision?
It is the regular blue view vision.
The regular
Yep.
blue view.
Just straight blue view vision.
Okay.
Yep.
Any printed brochures for these plans or PDFs only? Do you have a place you can print these off, or have we have brochures, sent to the client or to the broker?
We do not have anything printed. We don't have printed materials. Everything that we deal with now is just PDF.
Okay. Okay. Question from Scott. How do you quote the AEC option? Again, we're talking about the short term
Yep.
without preventative in the lesser RX tiers. I never see a less expensive option.
So the AEC product guides are also available on Anthem Broker Hub. So you can look through the benefit design so that you know which plan that you're looking for. But AEC is also quoted the same as what we just went through, the screenshots. one of the options is to quote ACA, and the other is the AEC, the Anthem Enhanced choice.
Okay, and I can walk you through that if need be offline, Scott, and be happy to do that. So everybody will get a copy of this presentation. Just want to wrap things up. Let's see, anybody more questions right now? Very comprehensive, portfolio of plans, short-term, dental, vision, of course, ACA, and this is this year, Anthem is paying SCP commission. I want to scream that from the rooftops.
Thank you, Geoff.
I do. I mean, I just walk up to people.
Pretty
on
important.
the street, SCP commission. Everybody. They need to know that. So, by all means, this is, Dayton, Ohio, you have 2 hospital systems. You have both hospital systems. Most
Yes.
carriers don't have that. A lot of carriers, or a lot of our agents today, are calling in from the Dayton area, and that's always been a problem.
Yes.
One takes Kettering, one takes Premier, but now Anthem takes both.
Yes. That was a big win for our provider team in the Dayton area. So important, and very exciting to have that. And we are seeing those results now. We have a huge surge in individual enrollments in the Dayton market. So
fantastic.
Definitely being effective, yes.
Fantastic. And now we've got a lot of folks looking at early retirement. They do that quite often in the springtime. Kids returning from school, going on their own plans. My apologies, I had a little cough. And Kathy, any final thoughts?
Any questions, please reach out to Geoff. Geoff knows where to get me if he doesn't know where they are. And we're certainly here to help you. Just wanted to give you a little taste of the products. But of course, if anything additional that you have, please let us know.
Fantastic. Okay. Look for the presentation. And one more question, maybe we'll have a chance to field this one. Are the vision plans available for over 65?
They are not. We only have the one dental plan that is available for over 65.
I got it. Okay. Fantastic, everyone. And look for your copy. And by all means, everybody have a fantastic rest of the day. We'll talk soon. Thank you, everybody.
Thank you.